Let's keep going with healthcare. Hospitals and doctors' offices in Colorado were hit hard by the financial crisis, and some are still recovering, especially in small towns. Steve Mort has the story.
At the Spanish Peaks Regional Health Center in rural Colorado, making medicine pay is a daily battle.
We just don't have a big profit center when you're in a rural area.
Todd Oberhue runs this hospital in the small town of Walsenburg. Like many remote communities, Walsenburg's population of just 3,000 is aging rapidly and is relatively poor. A large proportion of its population needs government help to pay for health care. Recent cuts in public spending means reimbursements to hospitals like this are falling, leaving towns like Walsenburg in danger of losing their medical facilities.
It's putting a lot of pressure on them to try to find a way to keep their hospital in their community.
Many people in rural areas lack private health insurance and can't pay for their treatment. High rates of obesity and diabetes put additional pressure on hospital budgets. It all means rural hospitals don't have sufficient money to attract enough medical staff. While Walsenburg is fortunate to have a well-equipped medical facility, many communities like this one across the United States aren't so lucky, with some people having to travel hundreds of miles just to get the critical medical care they need. The cost crunch means many rural hospitals face closure, in turn putting lives at risk, according to experts. A study by Colorado investigative news organization iNews shows the majority of U.S. traffic fatalities happen on rural roads, even though only 20% of Americans live in rural areas.
The more rural you are, the more remote you are, the more far away that this injury occurs from definitive care, the higher your mortality rate is.
Small populations mean ambulance services are also lacking in rural areas, often further delaying emergency care.
Ambulance services get paid for transporting people. So when that type of reimbursement model exists, obviously the encouragement is for people to be transported. And in communities where there are fewer and fewer transports, the smaller and smaller the resources exist within that community to provide that public service.
Meanwhile, the long-term fate of rural hospitals could be tied to the implementation of President Obama's healthcare reforms. Opponents of so-called Obamacare say cuts in government assistance will hurt rural facilities, while supporters say by ensuring more people, the financial future of small hospitals will be more secure. Steve Mort for Telesur, Walsenburg, Colorado.